am particularly interested. This is our fourth webinar of the season for me, and I am going to talk about a hot topic today, which is the facial changes that you undergo when you're on something like a GLP-1 or a GIP receptor agonist, and how we can navigate that with the tools we have in our aesthetic dermatology toolbox. So for those who don't know me, I am Ishii. I am a board certified dermatologist here at Aesthetic Solutions. I actually just recently celebrated my 2-year anniversary here, so time is flying, and I cannot thank you guys enough for always being so welcoming me into this practice. So we will get right into it here. So what exactly is pharmacotherapy in weight loss? So this has actually been around for a while. It's been around since before the GLP-1 era, but it is really weight loss induced by medications that you take. And this could take place in a variety of different mechanisms. So the way something like a GLP-1 or a GIP receptor agonist works is that it facilitates adjustments in appetite and satiety, or how full you feel, from both a GI standpoint and a neurological standpoint. So it changes your relationship with the food. It changes the signals of kind of fullness or even response to food cues, so you're not feeling quite as hungry, and therefore you're not going to eat as much or overeat. There's other mechanisms of action of other weight loss medication classes that might even decrease dietary fat absorption by the gut. So it's not just how GLP-1s work, but pharmacotherapy in weight loss has been around for a while now. Now, for particularly GLP-1s and GIP receptor agonists, it was originally FDA approved for patients who are overweight, obese, or have weight-related health conditions. And this could mean things like high blood pressure, type 2 diabetes, even certain types of arthritis, osteoarthritis, are included in this category. And the intention of these medications is that it is always best, of course, to be combined with a lifestyle treatment program that's going to be able to help optimize your lifestyle, your behavior, your changes in your nutrition, and so forth. But what really makes these GLP-1 receptor agonists and GIP-1 receptor agonists unique? It's really because these medicines are able to induce rapid and massive weight and fat losses compared to the other classes of weight loss medications. So, you guys know, of course, the original, which was Ozempic. There's also Wegovy. These are both semaglutides. In fact, hot off the press, I was actually reading the New England Journal of Medicine recently, and they are coming out, or they have come out with, an oral type of semaglutide, so no longer an injection, that can induce similar changes in fat and weight. So be on the lookout for that, because you're going to start seeing that. But other related medications, of course, include things like Zepbound, Mounjaro, or tirzepatide, which works on both GLP-1 receptor and the glucose-dependent insulinotropic polypeptide, or GIP receptors, which is the other one that I keep mentioning. Now, this rapid and massive weight and fat loss is what is associated with the development of what we call, quote, Ozempic face. So what exactly is Ozempic face? Now, Ozempic gets a bad rap because this Ozempic face was named after them, but, I think what we should really be doing is calling it more like GLP-1 or GIP receptor agonist related face, because it really can be seen with all of these classes of medications. And it's really an often altered or almost aged facial change that people notice when they start losing weight with something like Ozempic or these GLP-1 receptor agonists. And, it's very discouraging for a lot of patients because they feel so much better with their weight loss. They feel more confident when they look in the mirror, but when they focus in and zone in on the face, they notice that they look more tired or even older, despite feeling so much better and more youthful. And Ozempic face is more closely related to this massive and rapid weight loss. So what do I mean by that? That really means greater than 20 pounds lost within about 3 to 6 months. So that's kind of what the consensus idea of what rapid and massive weight loss and fat loss means. Okay. Even still, even with smaller amounts of weight loss on these medications, there seems to be like a unique pattern of this accelerated facial aging that's not seen with other methods of weight loss. So it's kind of this new evolving science that us dermatologists are seeing day to day, where we have patients come in that are on these medications and they're noticing these subtle changes. But Ozempic face is not really just about fat loss. Um, and I'll talk about this a little bit further in the next couple slides, but massive weight loss results in deterioration of collagen and even elastic uh, protein. So it leads to an increased fattiness or loss of elasticity, even kind of facial skin quality changes. Now, GLP-1 receptor agonists also may play an indirect role in facial skin hormonal regulation as well, and I'll get to that in a moment. But let's take a step back and go back to the fatty loss that we experience with these medications. So one key thing is that it causes total body fat loss, and of course that includes the face. So if you guys have ever sat in on a consultation with me, I always talk about kind of the 4 layers of the aging face, and that includes bone, fat, muscle, and skin. And fat plays a huge part of it because in the natural aging process of the face, you actually have shifts and changes in the fatty tissue. So some areas of the face, some fatty tissue actually decreases, so you get flattening of certain areas. That nice apple of the cheek that we used to have starts flattening out. We might lose volume in our temples or our lateral cheeks, and we suddenly look more like skeletal or gaunt. And this is all kind of part of the natural aging process. It happens to the best of us. But of course, on patients that are on these medications, such as GLP-1 receptor agonists, that process is accelerated. So in addition to that natural facial fatty change that occurs with the natural aging process, you're making it accelerate. You're making it go faster. So you're noticing more robust changes in that facial shape. Now, some studies suggest that GLP-1 receptor agonists can actually decrease the fatty stem cells from producing more fat. So even if we're trying to stimulate the tissue or trying to perhaps gain a little bit more weight back later on, sometimes it might be harder to replace some of that fatty tissue that we've lost. And as you guys know, as we have these changes, these volume shifts, it can cause to downward effects. So because we're losing that nice volume and that structure, we might notice that the lines are getting deeper, especially kind of around the mouth, like the perioral nasolabial folds, or smile lines or marionette lines. Those become more pronounced. Now, like I was saying, GLP-1 receptor agonists can also affect overall skin health. Now, GLP-1 and GIP receptor agonists are just so new into our field that we don't have direct data based on this. But relatedly, in patients who have also undergone massive and rapid weight and fat loss, such as like bariatric surgery, gastric bypass surgery, these patients have shown that their collagen fibers and elastic fibers actually deteriorate. They have biopsy data on this. So as a result of that, skin might look drier, skin might look dull. It doesn't look as supple. It doesn't bounce back quite as well. Okay, so even though we don't have this data for the GLP-1 receptor agonists yet, a lot of my patients come in and they say, well, you know, my skin, it's not just kind of the facial shape, but my skin doesn't look quite as radiant. My skin doesn't look quite as bright. And it's possibly because these kind of changes are undergoing underneath the skin. Now let's shift gears and talk about hormones. So as we know, as we enter into perimenopause, menopause, and then enter into postmenopause, our estrogen production by our ovaries decrease. And this is well studied actually with downward effects in the skin. So without this estrogen stimulation of our skin cells, our skin starts to look less supple. That crepey kind of tissue papery, cigarette papery look partially is due to that decreased hormonal stimulation of the skin. Now, I don't know if you guys knew this, but fat, adipose tissue, actually plays a role in production of some of this estrogen. And it's not taking the place of the ovaries, it's not producing that much, but it is producing a little bit of estrogen as we have fatty tissue in all of our body. So suddenly, as we enter into perimenopause, menopause, and postmenopause, and that estrogen production goes down, and we start using something like a GLP-1 receptor agonist, that estrogen production further decreases. Okay, so then we can kind of extrapolate that this might have a further effect on that skin quality from a hormonal standpoint. And for completeness sake, I do also want to talk about the muscle. So GLP-1 receptors actually are everywhere in our body, including the muscle, not just fat. And unfortunately, as of right now, these medicines, injected or taken orally, they can't distinguish between the receptors on the muscle and receptors on the fat. So all of it is going to be affected. So as we know, we have muscles in our face, and muscles actually change and evolve as time goes on as we age as well. So if the GLP-1 receptors are stimulated on the muscles of our face, could that be leading to further facial structure and kind of skin quality? Perhaps. So for completeness sake, I always talk about the muscle here as well, but we just don't have the data yet. So now that you guys are experts on what exactly causes Ozempic face, what are steps to minimize it? So we'll go through these in a little bit more detail here in just a moment, but this is kind of an overview. So first of all, I want you to, number one, ensure that you are nutritionally optimized with your primary care physician, your nutritionist, your dietitian, whoever is keeping an eye on you as you are going through your weight loss journey. And this is really important because if you're not nutritionally optimized, you're not going to respond quite as well to the treatments I can offer you. So I want to make sure that your nutrition is good so that you can actually respond appropriately to all the treatments that I perform in the office. You want to optimize bony structure and volume early on, okay? And I'll get to this in just a moment, but this is important. You don't want to have to wait all the way till the end and then having to play like catch up later. You want to make sure that you are kind of optimizing and prioritizing, maintaining that nice, youthful look that you have currently while you're going through the weight loss journey. As I said, Ozempic and GLP-1, GIP can affect the skin quality as well. So you want to layer in energy-based devices, lasers, light-based devices along and throughout your weight loss journey so that we can keep that skin quality up. We can induce collagen production. So again, we're not playing catch up later. And depending on your goals, depending on how much weight you've lost, and depending on kind of the end result, know that collaboration with a plastic surgeon may be necessary to actually get to your goals and get optimal results. And I am very honest about this. And if you guys have ever had consultation with me, you know I'm very honest about this. And I have a fabulous list of plastic surgeons in the area that do such a wonderful job that I always like to refer to and collaborate with if needed. So let's go through how we get through the treatment planning. So first comes the consultation, right? I always like to have a long consultation where we discuss your weight loss goals, your timeline, your facial rejuvenation goals, and talk about kind of your top concerns. I always try to do this, but especially in my GLP-1 GIP patients, I do what I call a 360-degree consultation of the face and if the body, if desired. But we go through those four layers: the bone, the fat, the muscle, and the skin. And I like to talk about and assess how we can best optimize all of those layers. Okay, so it's not just going to be fillers or just going to be neuromodulators. I look at the whole person and the whole facial structure to decide what combination of treatments is going to give you the best result. Of course, the weight loss journey is a marathon. We try not to make it a sprint, and it's a big decision for you. So I want to make sure that I come up with a nice long-term treatment plan and a maintenance plan so we can keep you feeling and looking your very best. And of course, if plastic surgery is something that you're interested in or something that I think might be in the future to give you the best results, I also start introducing you to my trusted plastic surgery colleagues so that they can be aware of your timeline as well. And you guys probably keep hearing me say timing, 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 and this is important. And this is exactly why. But I want to go through some steps with you of how I like to prioritize and time these treatments out throughout your weight loss journey. So we'll start with step one. Step one is facial structure optimization. What this means is I look at you preferably before the initiation of GLP-1 receptor agonist treatment, but of course can be done at any time, but earlier the better. Because in this step, I like to prioritize and optimize what we've lost with the natural aging process. So as you guys know, our bony structure changes, our fatty structure changes as we go through our natural aging process. So what I like to do is before even weight loss is something that comes up, I like to optimize the facial features first. As we kind of get older and our cheekbones start flattening out, I like to replenish and restore that nice volume back to that cheekbone. Our chin starts to recess in. We start to have this kind of flattened chin look. So I like to make sure that we're optimizing the chin. Even in younger patients that have not gone through significant aging yet, there's certain structures that we have lacked from birth. I see this a lot with like the jawbone and the chin, where you might look in the mirror and say, you know what, even when I was 17 years old, I never really had a strong jawline or a strong chin. In those areas, as we get older, because they start to shrink down, you might notice that, I think it might be nice to have a sharper chin or giving you a nice kind of elongated jawline. So these are some things that we can optimize in step one. Now, step two is two mini steps. So step 2A is going to be performed throughout the weight loss journey, and this is maintenance of that facial structure that we have optimized in step one. So as we go through our weight loss and as the fatty pockets shifts and changes, as you're noticing some flattening of certain areas, we try to maintain what we've established in step one, which is kind of your optimized and kind of best features overall. Now, step 2B is working on that skin quality and laxity. This relies on my energy-based devices, right? So my lasers, my light-based devices. And again, this is so that we can keep that collagen fresh, we can keep that skin quality fresh, and this is, again, best performed throughout the weight loss journey. Now, step 3 is your surgical intervention. In the consensus literature that is published in our dermatology literature, the best timing is to wait 6 months after weight stabilization. This could look different for different people. So weight stabilization means you get to your goal weight, and that's the weight that you want to maintain. Some people's goal is to get off these medications entirely. Some people's goal is to go down on the dose of the medication and stay on a quote maintenance dose. But whatever that might be, you want to be stabilized at your goal weight for 6 months before you enter into surgical interventions. Now, this of course is a case-by-case basis, which is why I like to introduce you to my plastic surgery colleagues early so that you can kind of establish a timing with them as well. Now, ensuring this optimal timing can greatly reduce the investment and the intensity of the procedures needed. That's why it's important to kind of do this procedure and do step 2A and B throughout the weight loss period so we're not having to play catch up later. So now's the fun part here. So let's talk about what treatments I have for you. So full disclosure, all of the patients I'm going to show you today are patients that have not undergone massive weight loss nor treatments with GLP-1 receptor agonists. But these patients have facial shape changes that are associated with these conditions. So I kind of want to go through systematically and talk to you about the procedures and the injectables I have to get you to your goal. So number one, to address volume and facial shape, so this is step 1 and step 2A, we want to target things like bony structure, fatty compartments of the face. I typically reach for a hyaluronic acid gel-based filler and a biostimulatory agent. I like to mix and match both. The hyaluronic acid gel-based filler helps me build back some of that bony structure, some deeper fatty structure. The biostimulatory fillers like Sculptra, Radiesse helps smoothen out those transitions so we can kind of keep things nice and useful. So another case here. So this is another patient of mine where I combined hyaluronic acid gel-based filler and Sculptra. So we have given her back those nice high cheekbones that she used to have, a little bit of jawline structure, and soften some of those transitions with Sculptra. And you can see that we've given her back a little bit more volume, a little bit more structure, and you can tell that she just looks a little bit more fresh. Let's switch gears here and talk about skin quality. So remember, skin quality means things like roughness, dullness, the loss of radiance, kind of how the light shines off the face, but it can also target things like discoloration, redness, brown spots, sun damage, okay? So this is a patient that underwent Q-switch alexandrite and the Fraxel laser combination, but lots of possible treatments are available. So we can talk about picotoning, Fraxel, halo, rewind time. We target the redness with B-beam, discoloration with my picosecond laser or the alexandrite laser. But a combination of these lasers can help you kind of brighten up the skin and make sure things are looking nice, even, and fresh. And this is a dramatic example. This is the same patient that I showed you on the hormonal-based slide, where you're starting to notice a little bit of that crepiness of the skin, almost like cigarette paper-like. And she underwent rewind time. This was my last webinar, if you guys were in that one, but I combined anywhere between 4 and 6 different lasers on the same day to give you more dramatic results. But you can see just how much better the skin quality is. The skin is more supple. You don't see that kind of crepey tissue papery stuff anymore, and things just look a lot healthier and fresher. And finally, let's talk about laxity. So laxity is kind of that skin that tends to hang, that is going to be accentuated as we start to lose the weight. So this can target things like the double chin area, loose skin, even crepey skin along the neck. And I do a combination or a variety of treatments. So the Sculpt and Lift jawline and neck treatment, I combine tumescent liposuction, where I'm able to physically take out any stubborn fatty tissue with a tightening device. The ThermiRF is that tightening device. It is a radio frequency heat device. Softwave is fabulous. I'm actually getting mine next week. I'm very excited. But that is an ultrasound-based tightening device that is non-invasive, and it's stamped over the surface of the skin that can help tighten it out, tighten things out, tighten out the collagen. And you can see in this patient here that Dr. Cox treated, that jawline looks just much fresher, and that skin just looks more taut and more lifted. If you have crepiness in the neck, you pinch the neck skin, it kind of stays, I actually reach for hyperdilute radius. So a combination of treatments may be necessary to get you the optimal result. This patient here, she had a little bit of that fatty tissue under the chin that was just not going away despite her healthy eating and exercise, as well as a little bit of that black skin. So for her, we did the Sculpt and Lift jawline and neck treatment to give you a bit more dramatic results. And finally here, so this patient has a combination of a couple of things. She has that skin quality kind of deterioration that comes with sun damage, the aging process naturally, that crepey appearing skin of the neck, that tissue papery stuff, and some sun damage that you can see with the brown spots. She also has a little bit of skin laxity there as well. So for her, we actually did some rewind time of fractionated CO2 to the neck. And while the fractionated CO2 does not help with the double chin fatty tissue, you can tell just how much healthier that skin looks overall over the neck. Of course, we did her face as well, so you can see just how much fresh her lower face looks, if you guys can see that. And then finally, you have to protect your investment, and you guys know this. I always harp on this if you've ever consulted with me, but maintenance treatment is key. So even after we've optimized everything, you've undergone your weight loss and you've completed it. You are on your maintenance dose of your GLP-1 inhibitor or GLP-1 receptor agonist, or you're off of it completely, you want to make sure you maintain those beautiful results that we've established. Medical grade skincare is also key. I will do the heavy lifting for you in the office, but I always like for you guys to do homework at home. And the medical grade skincare is something that you can do at home to keep those results looking fresh. So what's next? Book your consultation. Let's come up with your GLP-1 receptor agonist facial rejuvenation plan. I have a question. What do you think about microneedling? Great question. So microneedling has the unique opportunity to do two things. So not only does it help with a light resurfacing of the skin because it kind of goes and penetrates through the surface of the skin. If you have something like microneedling with radio frequency, it also offers some mild tightening effects. So I think microneedling plain would be really nice to help with that skin quality aspect we were talking about. And then microneedling with radio frequency is really nice for both skin quality and that laxity that you might see. Will this recording be sent out? So good news, it's actually being recorded and we will actually put this up on YouTube. So for patients that, or for you guys that couldn't come and watch it live, you guys can revisit it later. I have a question here. Can laser treatment be used on sensitive skin? The answer is yes. So depending, when I say laser, that is all encompassing. I have light lasers, medium lasers, heavy lasers, lasers that can do texture, pigment. It's endless. I have so many tools in my toolbox. So when you come into the consultation, I like to kind of establish the goals, how your skin tends to react with, certain procedures, certain products, so we can come up with a good treatment option for you that fits best with your skin and skin type. I have a question here. What is best for collagen building? Great question. So collagen building, I like to approach it kind of in two tiers, from the inside out and from the outside in. So from the inside out, I like to use a biostimulatory injectable, something like Sculptra or Radiax, because what that does is actually wakes up our own cells to produce more collagen, fresh collagen. It actually stimulates those cells called the fibroblasts. And helps with scaffolding of surrounding tissue so that the collagen can build around it. So I like to use that to kind of wake your body up in prime to start building that fresh collagen and volume. And then if we need to, I like to go from the outside in. So a lot of the laser procedures that go deep enough into the collagen layer and heat up that layer can help remodel and build collagen. Something like the soft wave, for instance, that we already talked about for the laxity, that will also deliver that heat energy 1.5 millimeters into the skin where the collagen lives to kind of churn out some of that collagen as well. Does Fraxel work? Yes. So Fraxel, we actually have 3 Fraxel devices, but the Fraxel that typically most people talk about is the Fraxel Dual. So Fraxel Dual has 2 settings. One is my photo damage setting that stays more superficial but can help churn out and kind of erase some of that sun damage that we have. Does a little bit of collagen because it does reach the superficial collagen layer. The second part of the Fraxel is a different setting that I'm actually able to go a lot deeper. So really, really great for things like scar remodeling, acne scars, and you named it, collagen building, because it's able to stimulate some of that deeper tissue where some of that more thicker collagen bundle lives. What is the downtime for Fraxel? So good question. Typically about a week. So 1 week where things are going to be red, all that sun damage or that collagen building kind of cell turnover is going to come up to the surface as coffee ground looking crust. And then that crust will kind of molt off over the course of about a week or so. At the 1 week mark, most of that crust is gone. You'll still be a little bit pink. That pinkness might last for another maybe 5 days or so, but it's about a full week of downtime. And when I say downtime, it's true social downtime. How often do you recommend the Fraxel? The way I do it, if we're trying to clear up sun damage, it's going to be once a year. If we're more trying to build collagen, it's typically a series of 5 sessions spaced 4 to 6 weeks apart, and then 1 annually. All right, you guys. Well, these are always so fun. Really, really good questions. Really, really fruitful. I hope for you guys too. I am here if you need me. You guys know where to find me. So if there's any questions, concerns, call us, let us know. I'm looking to see some of you guys for consultation. And as always, thank you so, so much for coming to my talk. I always love doing these. So good to see everyone. Take care.